Okay, right, next video is going to be ear bandage. So we are aware that there are different variations of this task between warding organisations. So please check with your individual warding organisation when it comes to looking at the specifics of your task. So I'm just going to walk us through the overall approach to doing a ear bandage. For those of you who is inapplicable, you will potentially have a wound to assess, and do that in the time it takes you to put your PPE on, so your apron and your gloves. If you're struggling with your apron, just ask someone to give you a hand to tie it up. You don't need to stand there struggling with it if it's not going on. But get your PPE on nice and quickly, look at the wound. Let's just say, for example, a puncture wound, dirty, so therefore using the appropriate dressing for that. And then move through to the patient itself. Now, hello sweetheart, let's have a little look. So we'll just have a little look to assess whether we're happy with our wound. So I'm happy that the wound is just here. So we'll move on through that. So I'll just say to the examiner, please examiner, would you mind restraining the patient for me because I need to access this ear. So if you can do so, it's slightly awkward the position of the patient as he is right now. So I would probably say if you wouldn't mind just helping me lift, and then if you could just place an arm underneath here and just a hand on the neck to stop them from bending around. Likewise, you might want to ask them to assist over the shoulder and you'll take control of the head. Either is fine. Demonstrating it to them is much quicker than standing and explaining, and subsequently therefore your patient's positioned how you want them to be. Now, our wound is on the undersurface of this ear, so that's my focal point to start with. And then we need to prepare our equipment and get everything ready. So you need to get on with this bit really. There's no need to spend too long on it. You don't need to be particularly neat and tidy prepping everything either. So I'm just going to prep that one just there, ready to go, on top of that one. And then open everything up and just crack on, get it open, get it to where you want it to be. And only when it's out of its packaging is it okay to go into our sterile area. So we just use a sterile area to identify where we want our equipment to go. As such. Dressings wise, there's various choices on the table here. I've got a choice here between a super absorbent dressing or a standard polyurethane foam. So I'm just going to go for the super absorbent one because I think this wound's likely to be a bit of a discharging wound because it's a puncture and it looks particularly dirty, so I'm going to use that. So I'm going to open it in a sterile manner, ready to go, get everything I need, ready to go. So, bandage material, bits and pieces, lovely. So we're going to pinch and take him off. And then we do have subsequent other parts here, so I'm just going to pop those off. Obviously, if you do have anything with the backing on, just do your very best with that. And then we're going to pop the patient's head in the position where we want it. So make the ear into a sandwich. Don't have too much cotton wool that it's excessive. Obviously he's got a shirt on here which is a bit in the way, you won't have that. But enough to give you a good padding under the ear, and then correct side down, and then subsequently sandwich again. And don't make it so fat that it's hard to bandage, don't make it so big that you find yourself having to fight cotton wool out of their eyes. You don't need that, okay? Then we start with our soft layer. So what I'm going to do here, it's dealer's choice, right-handed, left-handed, doesn't really matter. I'm going to start over here and then come in front of the face there and then coming around to this side. In terms of the other ear, I like to come in front and then we go behind where we last came, ideally 50-50, and then coming back around we now go behind the ear. And that then allows us to come forward. Now notice I've used quite a nice wide soft band layer. That allows us to be able to get really good coverage of the surface that we need to do. So I've gone again in front, down, behind, and up. And that's given me really lovely coverage. I'm really happy with that. And then it's nice and neat and tidy and I'm happy. And then this one again. Now this is a smaller roll, so just to show the difference as to how it can kind of make a bit of difference for coverage. And we are applying a bit of pressure with this layer. This is not an elasticated conforming bandage, so I am just going to be applying a bit of pressure. And as you can see, it's not covering as well as the larger size. And you might not have a choice. You've got to just work with what you've got. This for me is not big enough. in terms of how much coverage I'm getting. Not getting a kind of confident cover as I would have had done with the other. And again, I'm just going in front of the ear, behind the ear, and then in front of the ear again, just to get that little smidge there, and then back, and then round the back. And as you can see, the difference is on this side, if I just turn them around quickly, you can see that we haven't got as good a coverage. Now that's not my fault necessarily, because I'm dealing with a 2.5 centimetres less of material, so you've just got to do your very best. So I'm going to do a little cheeky tuck. But in an ideal world, my bandage material would all match in size. Now if I let go of this, he'll want to spring back, so I am just going to rest him there. And then again, back to the size that I prefer for this bandage. Again, you might not have had a choice, you've just got to do your best. But it just goes to show the difference in how it can apply in terms of what we need. So we're just doing a little bit of a tension release on it. Mill Pledge bandages, very kindly sponsored by Mill Pledge for our events, are usually rolled on to the right tension. And note where we're going. We're doing snail, shell on top for how we want our bandage material to be. And again, I'm just going to come behind the ear, trying not to toss them around too much, conscious that I've got both eyes as well. Pulling them off there, pull it off round, and as you can see here, far better coverage of that dressing. Obviously you won't have a pet shirt on your animal, that will make life far, far easier. And then I've got a little bit of a gap here again. This ear is always going to be a bit tricky, so I'm just going to do a little tuck and pull just to get him nice and neat to where I want him to be. And at the end of the roll, there's always a bit of a risk of it pinging off again, so we'll just take off that tension, come round, and he very neatly tucks under there, look. So didn't do that on purpose, there we are, seems quite happy. So, checks that we need to make: ear is out, eye is out, perhaps a bit snug on this side, maybe, if I was being really critical, a bit close to the eye there. So we probably would be more conscious to make sure that's a bit clearer, just so. White isn't visible, I'm happy with that. My ear's in. Tension check. He's got a pet shirt under this side, so it's making it a bit tricky. There we are, pull the pet shirt down. 2 fingers there. 2 fingers here. And I'm quite happy with how that looks so far. And then I need a Sharpie. We're only human. And I'm going to mark the position of my ear. So I'm going to do nice big triangle and then show the direction of the ear, just in case. Make it very obvious. So I'm now happy with that one. Again, neat and tidy, and if you're happy then PPE comes off. We use reusable aprons, so ours is going to go back on the table, but of course you need to make sure you bin yours. Off they come, and that is our head bandage.